Hello students, today we will discuss about the spinal cord. Now in today's discussion we will find out the answer of these two questions which are very commonly asked in your exams, that why spinal cord occupies only the upper two-thirds of your vertebral column. And the second question is that what are the differences between the dura mater around the brain, that means the cranial dura, and the dura mater and other meninges around the spinal cord. Clear? So these are the two very important questions which you should always keep in mind whenever you are reading the spinal cord. So let's discuss first, what do you mean by the spinal cord? Now the central nervous system, as you know, it is composed of the two parts. One is the brain and second is the spinal cord. So in this image, if you will see, this green color areas which are the centrally placed areas are the central nervous system. Now these both develop from the neural tube when you are talking about the embryology. Now the peripheral nervous system, which is the another part, is composed of the nervous structure which is outside the central nervous system. Now these nerves which are outside the central nervous system are actually the nerves which are connecting the central nervous system to the different part of the body. So this peripheral nervous system is a set of the nerves, and these nerves are connecting this midline central nervous system to the peripheral part of your body. And these nerves are of two variety. You know that it could be the cranial nerve or the spinal nerve. That means the connection of the brain with outside the body, outer side of your body surface is the central nervous system is having the cranial nerves, while you have the connection of spinal cord with the body with the help of your spinal nerves. So the cranial nerves and the spinal nerves are known as peripheral nervous system, and the brain and spinal cord is known as central nervous system. Clear? So the peripheral nervous system consists of the spinal nerves and cranial nerves. Along with that, you also having the other nerves which are connecting the central nervous system and the peripheral part, that include the visceral nerves, that include the plexus, and you have the enteric system. Clear? So in this way, first you should know what do you mean by the spinal cord. So spinal cord is a component of central nervous system, and it is connected with the part of the bodies with the help of your peripheral nervous system, which consists of spinal nerves. Clear? Now, so the spinal cord, if you will see, is an elongated part of central nervous system. Clear? Now, it occupies the upper two-thirds of the vertebral column in adult. Now, this is what you have always keep in mind, that when you will have the vertebral column or the vertebral canal, it occupies only the upper two-thirds. It does not present in the whole length of vertebral column. It is 45 centimeter long. Now, my dear students, this question has been asked so many times that name the structures which are 45 centimeters long. One of the example is spinal cord. And it is 30 grams in the weight, and it is inferior continuation of the medulla oblongata of the brain from the foramen magnum at the upper border of posterior arch of C1. So when you will see the upper limit, or you can say the point of the origin of spinal cord, you have to check it here that this is your central nervous system. Now this is the brain, and below and behind you will have the brain stem. Now here you can see that this is your medulla oblongata. Now this is the junction between the medulla oblongata and spinal cord. Now this junction lies at the level of the upper border of posterior arch of C1. So this is what again the important line, that what is the junction, level of the junction of medulla and the spinal cord. Answer is the upper border of the posterior arch of first cervical vertebrae. Now when you will see the lower end of this spinal cord, this lower end is known as Cornus Medullaris. Now this is very important term for your exam. What do you mean by the Cornus Medullaris? So Cornus Medullaris is the lower taper end of spinal cord, and when you will see the lower end of spinal cord, it lies at the level of the lower border of L1. L1 is there, but is it upper border or lower border? Answer is lower border of L1, which is the distal end of spinal cord. So if you'll see in this image, what you are able to understand, that this is your brain, now this is your spinal cord, this is the junction of the medulla and spinal cord. And when you will trace the spinal cord, you will find that suppose this is the complete length of your vertebral canal, but this spinal cord end at here only. And this tapering of the spinal cord here is a cone shape area, is known as Cornus Medullaris, which lies at the lower border of first lumbar vertebrae, and below that still the vertebral column is there where you have the canal, but that canal does not have this spinal cord. Clear? So this is what is the important concept. Now, this is again the question for your exam, that when you will have the long vertebral column and you have the short spinal cord, as I already told you, it occupies only the upper 2/3. The question is why it happened. So when you will have the intrauterine life, what does it mean? That in the embryonic life, we will talk up to the 3 months of the development. What will happen? Suppose this is the length of your vertebral canal or vertebral column. Now initially the spinal cord extends throughout the vertebral canal. That means you will have the upper end of spinal cord here and you will have the lower end of spinal cord here when you are of 3 months of embryo. Clear? So when you will have the 3 months of embryo, the length of spinal cord is equal to the length of bony canal. But what will happen, that there is a exit of the spinal nerves from the intervertebral foramina. So suppose you will have the spinal nerves, these are coming out from the corresponding intervertebral foramina. Clear? Now after that, what will happen? During the development, the vertebral column grows much faster than the spinal cord. Or you can say that bony growth is faster than the nervous tissue. So this is the nervous tissue, this is the bone. So what will happen later on, that this bone will enlarges or it grows faster as compared to the nervous tissue. So nervous tissue is having a relative ascent inside the canal. Why there is a relative ascent? Because this outer bony coverage, or you can say the bony canal, grows faster and the neural tissue is not able to cope up with the length of vertebral canal. So you will find there is a relative ascent of the spinal cord, and as a result the spinal cord does not extend the entire length of the vertebral canal due to gradual ascent. So there is a gradual ascent is seen. Why you are able to see that there is a gradual ascent? Because this outer tube elongates faster and this length of spinal cord is not growing so rapidly as this bony canal. So finally, what will you find, that this is the lower end of your spinal cord while this bony canal grows downwards. So what is the impact of this? So what will happen, that so the spinal cord ends at the level of L3 at birth. So when you will have the newborn baby, you will find that spinal cord lower end, which was earlier is equal of the length of vertebral column, now end at the level of third lumbar vertebrae. But in adult, the spinal cord typically ends between the L1 and L2. Now this is first and most important question of your exam. Although it can be high up to the T12 and it can be low as up to the L2, L3. Clear? So these are the variation, but the most common level is L1, L2. So now the next question comes is that what is the effect of the short spinal cord on the spinal nerve? Now you have to keep this thing in mind, that spinal nerves originate from the spinal cord and they have increased oblique angle. Now what is the impact occurs? The impact occurs is that the exit of a spinal nerve is now not remain straight, they will show some obliquity, and when you will go lower down, the obliquity will increase, and this obliquity is more pronounced into your lumbar and sacral spinal nerves. So what you are able to understand here, that nerve roots of the spinal nerve have to travel longer distance as it passes in the vertebral canal. Now why it happened? Now suppose I am saying that this is the length of vertebral canal inside the intrauterine life when you will talk about the 3-month, and at the same time in 3-month of embryo you will have the spinal cord which is equivalent to the length of your vertebral canal. So at this time what will happen, that spinal nerves are coming out from their corresponding intervertebral foramina. Clear? This concept has to be there. Now in the intrauterine life what is happening, that suppose this is a lumbar vertebrae and this is, suppose this is L4 and here you will have L5, then this area is for the sacrum. So what you are able to understand, that sacral nerves are exiting at the same level between the sacral vertebrae. But later on what happened, that sacrum has been shifted downward. Why? Because of the rapid growth of bone. So now sacrum is present here. Now this is the sacrum. Now what will happen with this nerve? Now this nerve exit will not change, the exit will remain same, but the length of the nerve roots will increase. So this nerve root which is coming out now, rather than at this point, the nerve root will come out like this. So what you are able to understand, that the point of exit will not change, the point of exit will remain same, but because of the shifting of the point of exit, what will happen, the nerve length will increase. Particularly we are talking about the roots of the spinal nerves. So the nerve roots of the spinal nerve, now this is the first thing, that this is not the trunk, it is the root of the spinal nerve which has to travel longer distance as it passes in the vertebral canal. So now these are traveling a longer distance. Their spinal cord level of the origin thereafter become increasingly dissociated. Now why there is a dissociation occurs between the exit of the spinal nerve and their intervertebral foramina? Because this is the important thing which you have to keep in mind, that the growth of the bony channel is faster than the neural tissue. So what will happen, that their vertebral column level exit is changed, and because of this you will find the obliquity in the spinal nerve roots, and this is more pronounced in the lumbar and sacral spinal nerves. Clear? So when you will see this image, now here also you can see that this is what you can see, that these are the lower nerves or the lumbar nerves which has to go obliquely downwards because they has to come out from the corresponding intervertebral foramina. Clear? Now the next part comes about the meninges of spinal cord. So within the vertebral canal, you know that spinal cord is covered by the 3 layers of the meninges, as you know, around the brain. So from inside to outside, innermost is pia mater, then arachnoid mater and dura mater. And you know that out of these 3, dura mater is a thick, non-elastic and fibrous meningeal layer. So in this image also you can see that this is what is a tube of dura mater. Inside that you will have one more tube of your arachnoid mater, and this is the innermost tube of pia mater which is very adherent to the neural tissue, or you can see the spinal cord. So the meninges, they extends from the foramen magnum down the vertebral canal, and all the 3 have the tubular sheath around the spinal cord. Now the sheath terminates at the different level. Now this is what you have to always keep in mind. Then you have, if you will have this question in exam, what is the lower termination of dura, arachnoid and pia mater, then there are 3 different levels which we will discuss in the coming part of this lecture. Now when you will have the spinal meninges, in between the spinal meninges you will find some spaces. So the pia mater is the innermost membrane and it intimately associated with the surface of spinal cord. So this is the first thing, that when you are doing the dissection, if you will take it out the spinal cord, you are not able to appreciate the pia mater because it is a transparent membrane and it remained firmly adherent or intimately associated with the spinal cord. The arachnoid matter, now when you will see the arachnoid matter, it is separated from the pia mater by a very important space is known as subarachnoid space, and you know that subarachnoid space contains the cerebrospinal fluid. The thickest and the most external of the membrane is the dura mater, and it is separated from the arachnoid by the subdural space. Now in the vertebral canal, the dura mater is again separated from the surrounding bone, and that is known as extradural or epidural space. And this is important to understand that this epidural or extradural space contains the connective tissue, fat and a venous plexus. So if you will see this image, what you are able to understand that this is your bony canal. And this bony canal, if you will go from inside the bony canal, first you are able to see these veins. These are the venous plexus. Now just inside the venous plexus, you will have this outermost covering is your dura mater. So this is the dura mater. Now inside the dura mater, you will have arachnoid mater. Inside the arachnoid mater, you will have the pia mater. So what are the spaces? Now you have to keep in mind that the space which is outside the dura, this is extradural space. Now this is subdural space. This is subarachnoid space. Clear? So there are three spaces: the space which is outside the dura, the space between the dura and arachnoid, and the space between the arachnoid and pia mater. Clear? So these are the spaces which are present in the around the spinal meninges. Now again you will have the next question is that what are the differences between particularly the dura mater of the brain or the cranial cavity and the dura mater of spinal cord. So the first difference comes is that the extradural space which we are talking about is present around the spinal cord, but this space is absent in cranial cavity. Now this is what you always keep in mind, that when you are talking about the spaces inside the cranial cavity, you are having the subdural space and subarachnoid space. But when we will talk about the spaces around the spinal cord, then you will have extradural space, subdural space and subarachnoid space. Now why the extradural space is absent around the brain or inside the cranial cavity? So the first reason is that the cranial dura consists of the two layer, outer endosteal and inner meningeal layer. When you are reading the spinal cord, you don't have the two layer of dura, you are having only single layer of dura which is known as meningeal layer. But when you are talking about the brain is having the two dura, outer dura is known as endosteal layer and inner dura is meningeal layer. So the endosteal layer of the cranial dura is inner periosteum of skull bone. Now what does it mean? Now suppose this is your bone of cranium. Clear? Now this bone of cranium is having the inner periosteum and this is having the outer periosteum. Now my dear students, now this outer periosteum is the fifth layer of scalp which is known as pericranium. Now this is the innermost layer on the inner side of your bone, and this layer is again the periosteum. But this periosteum is known as endosteum. So what is endosteum? Endosteum is nothing but it is a inner periosteal lining of skull bone, and this layer does not have continuation in vertebral canal. Now what is the another meaning of this line? Now suppose if you will see that you will have the foramen magnum. Now suppose this is the foramen magnum and you know that here is the brain and this brain is continue as a spinal cord. Clear? Now what you will find? You will find that this meningeal layer of dura which is here, now this is the meningeal layer of the dura, is continue around the spinal cord. And this meningeal layer of dura is forming the dura mater of spinal cord. But when you will talk about this periosteal layer, this periosteal will come out and it will continue with the outer side with this pericranium. So what you will find that this is your inner layer, or you can say the endosteal layer is not having any continuation around the spinal cord. So what will happen that you will have a separate bony canal which is known as vertebral column, and vertebral column is lined by its own periosteum. It is lined by its own periosteum. So whenever you are having the question in exam, you always keep this thing in mind that this inner lining, which is known as endosteal dura, is not having continuation in vertebral canal, rather than it continue with the pericranium outside the skull. The only this meningeal layer of the dura mater continue as a dura around the spinal cord. So because of this reason, the gap appears around the spinal cord is extradural space. So again I will read it out that the cranial dura consists of outer endosteal inner meningeal layer. The second reason is the endosteal layer of cranial dura is forming the inner periosteum of the skull bone, and this layer does not have any continuation in the vertebral canal. So the meningeal layer of the cranial dura continue downward into the vertebral canal as a spinal dura. So if I will ask you spinal dura is a continuation of, answer is meningeal layer of cranial dura. The vertebral canal possesses its own periosteum, so the extradural space is a feature of the spinal cord which is absent around the brain or inside the cranium. Clear? Now, in this video clip, if you will see the layer of the dura, now you will find out that this is the posterior part of your skull. So we just remove this posterior part of the skull and the bones. Now as soon as you will remove, you are able to see this endosteal layer, which is the periosteum. And this periosteum, if you will remove, will find one more layer, and that layer is now the meningeal layer of dura. So the difference is that you can see that this meningeal layer of dura is showing the clefts, or you can say they are showing the folds, and this dura is continue in the spinal cord. So there are two layers of the dura in cranial cavity. One is the periosteum, which is known as endosteal layer, and second thing is this meningeal layer of dura, and this meningeal layer of dura continue in the spinal cord as a dura of the spinal cord, and this dura mater, that means the meningeal layer, is showing some special features, like you will have the folds which are going inside, and in these areas you will have the dural venous sinuses, and these folds and dural venous sinuses absent in the spinal cord. Clear? So the second difference comes is that the meningeal dura of cranial cavity shows the dural fold, and these dural fold contains the dural venous sinuses. This feature is absent around the spinal cord. So here in this image you can see that this is the folding occurs, and this folding is a feature around the brain in the cranial cavity, and such foldings are absent around the spinal cord, which is formed by the meningeal layer of dura mater. Clear? So whenever you are reading the dura mater particularly, you have the two differences. One difference is that the dura around the cranial cavity is a bilateral. You have outer endosteal in a meningeal layer, and the meningeal layer will show the foldings and dural venous sinuses. So in this image also, if you can see, you will appreciate that this is a dural venous sinus, and this dural venous sinus occupy the folds which are here. Clear? Now in this image, what you are able to understand that when the folding will occur, now this is the folding. Now this folding is produced by the meningeal layer of dura, while this endosteal layer of dura is covering here. Now this point of the separation is showing the formation of dural venous sinuses, and such dural venous sinuses are not seen around the spinal cord at all. Now we'll come to the features of the dura mater around the spinal cord now. So you know that it is a tough fibrous sleeve of the dura. It extends from the margin of the foramen magnum to the second sacral vertebrae. Now this is the lower limit of your dural sac or dura mater. What is that? S2 level. That means second sacral vertebrae. At the foramen magnum, as I already told you, that this spinal cord starts from the medulla oblongata. Along with that, you will have that the meningeal layer of the dura mater continue around the spinal cord as a spinal dura, and at the second sacral vertebra, it close onto the arachnoid mater and fuse with the phylum terminal. So now, if you will see this image, what is that actually? We have cut the lamina of the sacrum, and you are now seeing the sacral canal after opening it. Now here you can see that these are the roots of the spinal nerves which are going downwards, and in the center you can see that this is the phylum terminal. Now what will happen that on the outer side here you will have the outermost covering, and that covering has to be the dura mater. Now in this, what you are finding that this is the S1 and this is the S2. Now what will happen that when you will trace this sac, now this sac or this tube of the dura will go and it will end at this level, something like this. So when you will see the image of the dura, you have to keep this thing in mind that dura mater will not end at L1. Most of the students are having this confusion that spinal cord ends at the level of L1. Then the dura is also end. No, dura will not end. Still the dura is going downward, and where it ends? It ends at the level of second sacral vertebrae. Clear? It will not end at the level of L1. So the dura is separated from the wall of vertebral canal. As we have seen, there is an extradural space, but there are some locations where you have the fusion of the dura with outer periosteum. What are these spaces? First, to the posterior longitudinal ligament at the level of the bodies of the second and third cervical vertebrae. So at the level of second and third, you will find that the dura is having connection with the posterior longitudinal ligament. And second thing is that the intervertebral foramen by the extension around the root of a spinal nerve. Now here you can see that these are the intervertebral foramina, and in the intervertebral foramina you will find that this is the extension of the dura. So this is again the question of your exam, that dura mater extends laterally as a, so answer is they extend around the root of your spinal nerve, and these attachments are important to hold the dural sheath, so there is no great affection of the movement of vertebral column seen on the spinal cord. Because when you are moving the vertebral column, the spinal cord should be remain fixed in its own position, and that is possible because of these some attachments of the dural sheath with the surrounding areas. So the dura mater forms a separate sheath for each dorsal and ventral root. Now here in this image, what you are able to understand that there is a outermost covering of dura mater, and that dura mater is also covering the ventral root and the dorsal root of spinal nerve separately. Now here you can see that this is the one covering and this is the another covering. Clear? Now this is the covering on the dorsal root because this is the dorsal root ganglia, and this is the covering on the ventral root. And both of them are meeting medially. So the adjacent surface of these sheaths fuse at the medial side of the spinal ganglia and become continue with the epineurium of the spinal nerve. So you know that this is the fusion of your both covering of ventral and dorsal root, and then this will continue as a epineurium of spinal nerve. So you know that nerve is having the three-layer endoneurium, perineurium and epineurium. So dura mater is also helpful in the formation of epineurium, and it continue with the epineurium of nerves. Clear? So this is what you have to always keep this thing in mind, that this dura when extend laterally around the spinal nerve, it merge with the epineurium of the nerves. Now what are the features of arachnoid mater? Now arachnoid mater is a thin transparent membrane, and it lines the dural sac throughout its length. Now what is the meaning of throughout its length? It means that the dura end at the level of S2 level, so that arachnoid mater also extend up to the second sacral vertebrae. So this is again the question you have to keep in mind, that dura and arachnoid mater both are having the lower extension up to the S2 level. But the dura and arachnoid matter are separated by a space is known as subdural space. It is a space outside the arachnoid matter but on the inner side of dura. There are some places where dura and arachnoid matter fuses with each other. Now what are these places? First place is at the intervertebral foramen around the spinal nerves. So I just told you that when you are talking about the spinal nerves, these spinal nerves are coming out through the intervertebral foramina, and at the level of intervertebral foramina, what will happen? You can see that this is the arachnoid, but along with the arachnoid, this inner dura and arachnoid both are extending laterally. So this outer layer of dura and inside that you will have the arachnoid, both are extending laterally and they will fuse here. So this is the one point where you will have the fusion, that is the exit of your spinal nerve through the intervertebral foramina where outer dura and inner arachnoid fuse. Second thing is on the phylum terminal at the level of S2. Now this is again the important question to understand, that when we will have the lower end of your dural sac. Now I just told you that this is the lower end of dural sac, and this lower end of dural sac is at the level of S2 level. It is not L1. Clear? L1 should come here when you are talking about the conus medullaris of your spinal cord. But this dural covering of spinal cord is still continue downward up to the S2. And you know that inside that you are having the arachnoid matter. Now this arachnoid matter is also continue till S2. Clear? So this has to be very very crystal clear in your mind that the outer dural sac and inner arachnoid matter are continue till S2 level. So at this lower end, what will happen again? This outer dura and inner arachnoid matter are fusing with each other with a extension from lower end is phylum terminal. So this is the phylum terminal. So at this point you can see the arachnoid and dura mater are fusing with the phylum terminal. And the third point is that where the teeth of ligamentum denticulatum passing laterally through the arachnoid to dura mater. Now we will see this ligamentum denticulatum, which is a lateral extension of the pia mater, and when they are going laterally, they are piercing first the dura and then they will attach to the arachnoid. So when it is piercing the arachnoid to meet at the dura, again there is a fusion of these two layers. So again this question comes in exam, that there is a separation of dura with underlying arachnoid matter by the subdural space, except answer is three places. One is intervertebral foramina where you will have exit of the spinal nerve. Second, at the level of S2, that is the terminal point of the termination of your dura and arachnoid. And third point is the points where it is punctured by the ligamentum denticulatum. So deep to the arachnoid, you will have the subarachnoid space. Outside the arachnoid, you have subdural, and deep you will have subarachnoid space, and you know it is having CSF, and this space is having only the few fibers of connective tissue which form the deep surface of the arachnoid to the pia mater around the spinal cord. Now here you can see that this area is arachnoid, and deep to that this is the subarachnoid space, and in this space you are able to see these fine threads. These fine threads are passing through the subarachnoid CSF and they are approaching this outer layer of this area, which is the pia mater. So this space is crossed by the ligamentum denticulatum. Now here you can see that this is the pia mater, and this pia mater is giving the extension, and this extension is a teeth-like process, is ligamentum denticulatum, and this ligamentum denticulatum is crossing the CSF area, that is subarachnoid space. Now what are the features of the pia mater? Now when you will see the pia mater is a vascular membrane. And the another thing is it is closely adherent or intimately related to the outer surface of spinal cord, and this pia mater ensheath each rootlet of spinal nerve as it crosses the subarachnoid space and become the continue with perineurium. Now see, you have to keep this thing in mind that dura mater continue with the outer layer of the nerve, that is epineurium, while the pia mater continue with the perineurium. So here if you will see that these rootlets of spinal nerves which are exiting from your spinal cord are covered by the pia mater, and these rootlets are important to understand because when you will have the extension of the spinal nerve, as the pia is going around that, some part of the subarachnoid space will also enter into this area of the exit of spinal nerves. Clear? And what will happen about the pia mater? That pia mater continue with the perineurium. The pia mater also extend into the nervous tissue inside. Now this is the nervous tissue in the center. So this pia mater will also go inside. Now how it will go inside? It will go inside with the help of these blood vessels. Now here you can see that this is the artery. Artery is giving the branch. These branches will puncture the spinal cord to supply blood. So when the arteries are going deep into the spinal cord, along with that, some extent of the pia mater will also enter from this outer side of the surface of spinal cord to the inner side. So the pia mater also extend into the nervous tissue for a short distance along with the vessels which are entering the spinal cord and carrying a short sleeve of the subarachnoid spaces also, and these are known as perivascular spaces. So perivascular spaces are seen inside the nervous tissue, and these peri means around, vascular means blood vessels. So these spaces around the blood vessels are present there because they are having a small extensions of the pia mater along with that, and because outside the pia mater you will have subarachnoid space, so that subarachnoid space is also shows very short extensions inside the nervous tissue, and that is known as perivascular space. So now the next part comes, which is a very most important question, is what are the some modifications of the pia mater. So there are three modifications of pia mater: linea splendens, phylum terminal, and ligamentum denticulatum. So if you will see this image, I will first tell you what are the position. So when you will have the cross section of your spinal cord, you know that this is the anterior side of the spinal cord, this is the posterior side of the spinal cord. Now anteriorly here in midline you are having the anterior spinal artery. And when you will have the dissection around the anterior spinal artery, you will find a ridge-like thickening. That ridge-like thickening which runs on the anteriorly is linea splendens. Now what is ligamentum denticulatum? Ligamentum denticulatum are the lateral extension. You can see that these are the lateral extensions of the pia mater which are tooth-like appearance, and these are ligamentum denticulatum. And what is phylum terminal? Phylum terminal is a lower continuation from the Cornus Medullaris, and that pia mater which extend from the Cornus Medullaris is the phylum terminal. So let's discuss these three things one by one. First is the linea splendens. So when you will have the dissection and when you will see this spinal cord from the front, on the midline anteriorly you will find a thick band, and that thick band is known as linea splendens. So linea splendens will come here on the anterior surface of the spinal cord in the whole length. Clear? So pia mater extend into the anterior median fissure of the spinal cord, and it is a thickening at the mouth of the anterior median fissure from the median longitudinally. It is a glistening structure or the band, and this band is present here. So this band which is present here on anterior side of spinal cord deep to the arachnoid mater is linea splendens. Now what is ligamentum denticulatum? The ligamentum denticulatum is a thin longitudinally oriented. It is not horizontally oriented, they are longitudinally oriented sheet, and these sheets are made up of pia mater. So they are made up of pia mater on each side of spinal cord. It is not present on unilateral, it is bilateral structure. Now the second thing is that it lies in a midway between the attachment of ventral and dorsal nerve root. Now you know that there are two roots of the spinal nerve, ventral and dorsal. So suppose if you will have the spinal nerves which are attached here on the spinal cord, so you will have the ligamentum denticulatum between these two roots, clear? So they lies between the dorsal root and the ventral root of spinal nerve. So it extends from the cord towards the arachnoid and dura mater. So when you will see the this image, you will find that this is your spinal cord. Here you will have the arachnoid mater, and on the outer side of the arachnoid, this is your dura mater. So this is the extension from pia mater laterally towards the arachnoid and to the dura mater. So the ligament extends from the foramen magnum. So you will find these all ligamentum denticulatum inside the your area of spinal cord, which is upper 2/3 of vertebral column. Now this is the important thing to understand, that the ligamentum denticulatum starts from the foramen magnum and they will end to the first lumbar vertebra, that is the lower end of spinal cord. Now my dear students, you have this thing always in your mind that ligamentum denticulatum does not present in the complete length of vertebral column. These ligamentum denticulatum are present till the cornus medullaris, that means the lower end of spinal cord at the level of L1. So that's why they are only 21 pairs. They are not completely present. Why they are 21 pairs? Now suppose you will have the cervical region, you will have the 7 vertebrae. In thoracic region, you will have 12 vertebrae. In lumbar region, you will have the lower end of spinal cord at L1. So if you make it total, it is 20. It is 20. 12 plus 7, 19 plus 1, 20. But you will find the ligamentum denticulatum are 21. Why? Because it starts above the C1. So first ligamentum denticulatum, the first projection is at the foramen magnum and the last is between the T12 and L1. So the one which is above the C1 is also come here, and then the total is 21. Clear? So this should be always in your mind, that ligamentum denticulatum are, why they are 21? Because they end along with the spinal cord at L1. And because they end at the L1, the total number is 20, but the one which is here extra is above the C1. So one is above the C1, then below the C1, below the C2, below the C3, below the C4, something like this. So you will find that the total number is 21. So these are the ligamentum denticulatum which are going laterally, and you will find that one set of the roots are visible here and one set of the root is visible behind. So they are present between the ventral and dorsal root of spinal cord, and you will have the lateral extension of pia mater. The second thing which is very important is that their attachment. So medially, each ligamentum denticulatum attached to the spinal cord in a plane that lies between the origin of anterior and posterior root of the spinal nerve, which I just told you. But when you will see the lateral attachment, each ligamentum denticulatum form a series of triangular extension. So you can see that this is a triangular extension. Now this triangular extension, when you will see, is going laterally, and the apex of this triangle crosses first the subarachnoid space. So this is the subarachnoid space. So it is passing first through the subarachnoid space, then it punctures the this arachnoid mater, and ultimately it will merge with the outer dura mater. So this is what is important to understand, and it is so many times asked in your exam that which structure crosses the subarachnoid space. So ligamentum denticulatum also crosses the subarachnoid space because it has to attach on the dura mater. So it has to pass through the subarachnoid space, then it has to puncture the dura, then the subdural space, and ultimately it will get attached to the dura mater. Now the second and most important thing is that this lateral attachment lies in an interval between the two adjacent spinal nerve. What does it mean? Now this is the exit of one spinal nerve. This is the exit of another spinal nerve. So the ligamentum denticulatum is here present in between these two. In the same way, this is the exit of one, and above exit will come here, then you will find this is the attachment between the exit of two spinal nerve. So when you are having the ligamentum denticulatum, there are 3-4 things which are important to understand. That ligamentum denticulatum is formed by the pia mater. Second thing, ligamentum denticulatum lies between the ventral and dorsal roots of the spinal nerve. Third thing is that it pierces or it passes through the subarachnoid space. And fourth thing, they are 21 in number. And the fifth and last thing is that they attached on the dura mater between the exit of two spinal nerve or between the two intervertebral foramina. So what is the function of these ligamentum denticulatum? So when you will have the pair of ligamentum denticulatum, because I told you they are present on right and left side, they function together to suspend the spinal cord in center of the subarachnoid space. So this is the important function, that these ligamentum denticulatum is helping to provide support to the spinal cord to remain in the center of subarachnoid space, and they allow some movement of dura mater without corresponding movement of spinal cord. That means whenever the spinal cord is having very vigorous movement, like you are doing this type of the movement, that means there is a flexion of the trunk, the spinal cord is also try to move along with the vertebral column. But if such free movements will take place in the spinal cord, the nerves will tear down. So to avoid such movements of the spinal cord along with the vertebral column movements, these anchoring ligaments like your attachment to the dura with the periosteum, attachment of the pia mater with the dura mater, these all connections prevent the movement or vigorous movement of the spinal cord inside the vertebral column. The last modification of pia mater is phylum terminal. The phylum terminal is a thin filament, and this thin filament extends from the narrow end of spinal cord, that is conus medullaris. Now here in this image, you can see that this is the lower end of spinal cord. Now again you have to understand that this is the L1 and this has to be the L2. So this is the lower end of spinal cord at the L1, L2. And it is intimately related with a covering which is known as pia mater. Now what will happen, that this pia mater continue downward. The pia mater will not end here. The pia mater is continue downward as a phylum terminal. This phylum terminal is further covered by the dura and arachnoid, which are still continue downward, and you know that this is the lower end of the dura and arachnoid, which is the level of S2. Clear? And still this pia mater is continue below the S2, and ultimately it will come out from the sacral canal and it merge with the periosteum of coccyx. So it is among the descending roots of the lumbar and sacral nerves. So here you will have the lumbar and sacral nerves which has to come out from their corresponding foramina. And this whole area is known as cauda equina. And if you will see the cauda equina, in the cauda equina you will find a silvery appearance structure, and that is your phylum terminal. It is composed of mainly the pia mater and some of the neural tissue which are coming from the spinal cord. At the level of the second sacral vertebra, as you know that this second sacral vertebrae is the terminal point for the dural sac, and inside the dural sac arachnoid matter. The spinal arachnoid and dura fuse with the phylum terminal. So here you can see that this is the phylum terminal where you will have the fusion of the dura and arachnoid. This phylum continues throughout the sacral canal and fuse with the periosteum on the back of the coccyx. Clear? So now here you can see that this much is the phylum terminal. And some books are having the classification, the area of the phylum which lies inside the dural sac and subarachnoid space is known as phylum terminal internum, or it is also known as pial part of the phylum terminal. And the part of the phylum terminal which is outside the dural sac and subarachnoid space is known as phylum terminal externum, or it is also known as dural part of the phylum terminal. Clear? So in short, whenever you are reading the phylum terminal is nothing but it is a lower extension of your pia mater below the level of L1, and this pia mater extension which is phylum terminal is merged with the dural sac and arachnoid mater at the level of S2, but still after that it continue out and it is at the end of coccyx merged with the periosteum. So in this image, in this video clip, if you will see, what you are able to understand that this is your vertebral column. Now if we will remove the vertebral column, you are able to see the dura mater. And you know that the length of dura and length of arachnoid mater is similar, which is going up to the second sacral vertebra. So now if you will remove the dura, along with the dura, your arachnoid mater will also disappear. And inside that, now you can see that this is the lower end, which is your conus medullaris, and below the conus medullaris there is a very thin filament is visible, and this thin filament is your phylum terminal. Clear? So now this should be very clear in your mind that whenever we are talking about the meninges of spinal cord, you have to keep this thing in mind that spinal cords are having a longer extension than the spinal cord itself. The spinal cord ends at the level of L1, but the meninges are going down, and L1, the dura mater and the arachnoid mater end at the level of S2, but the pia mater still come out as a phylum terminal externum till the coccyx of your vertebral column. So this is all for the today's session. Thank you.